Migrants, asylum seekers, and refugees are still on the move, even as COVID-19 grips countries around the world. In Libya, fears of the spread of the virus are compounded by years of fighting and internal strife, plus tighter restrictions on movement are creating new challenges for vulnerable groups.
So we've seen that over the weekend, over the Easter weekend, where we had people trying to flee Libya. And we know that these days, taking a ship, a boat, a flimsy boat to leave Libya is the only possibility because the borders are closed, the airports are closed, there are no evacuation by the UN of the most vulnerable ones, the refugees.
Libya's conflict, now more than 5 years old, has devastated health infrastructures in the country.
And then on top of it, we're dealing with populations that already have difficulty accessing health services. So that's migrants, it's refugees, it can even be very much internally displaced persons. So Libyans in their own countries may have difficulty accessing health services.
In March, the United Nations Refugee Agency reported some 800 people attempted to cross the Mediterranean Sea after departing from Libya. In April, the Libyan Coast Guard said it had rescued 280 migrants and returned them to shore. But Libyan officials denied them entry as the country shut down its borders because of fears of COVID-19, according to the UN. Closing or restricting borders are measures taken by countries to prevent the spread of the virus. The action, in some cases, has dismantled freedom of movement, including imposing curfews, which is making it difficult for anyone to move about, including migrants, refugees, or asylum seekers.
So we have the conflict, we have a weak health system, we have COVID cases that have been declared. So this is not some sort of theoretical question. It is happening now. And we have people who are extremely vulnerable because of their living conditions. The migrants, refugees, and asylum seekers, as mentioned earlier, but also people who have been displaced by the conflict in Libya.
Over 370,000 Libyans are internally displaced in a country that hosts more than 38,000 refugees. International aid groups say preventative measures like social distancing and hand-washing in a refugee and internally displaced person camp is a challenge.
So the job now is we're really in a race against time to prevent the virus from getting into these places to begin with. So making sure people have things like running water and soap, which many of us take for granted, for example. A lot of the recommendations like physical distancing can be really challenging if you are living in a crowded refugee camp.
For now, Wells says, one of the most important things to do is spread awareness and credible information. Ayen, Deng, Bior, VOA News, Washington.